Imagine going to bed early to get a full night's sleep, waking up feeling sleepier than before. Over time, you try to make sure you get enough sleep, but it feels like you never can. You start to wake up with headaches, body aches, and sometimes chest pains. This is the reality for many people who are living with sleep apnea. Did you know that according to the American Academy of Sleep Medicine, at least 25 million adults in America are afflicted with obstructive sleep apnea? As a person who has the worst form of sleep apnea, which is severe obstructive sleep apnea, and has researched this topic thoroughly, I hope to help others realize early signs and symptoms, be able to get early treatment. Sleep apnea is a very common and underdiagnosed sleeping disorder, which has many negative health effects. Common symptoms which may be overlooked include snoring, daytime sleepiness. Early diagnosis and treatment are important when it comes to sleep apnea. First, let us discuss what sleep apnea is and how it occurs. Sleep apnea is a disorder where a person repeatedly stops breathing during sleep. The pauses in breathing are called apneas and can last 10 seconds or longer. A person with sleep apnea may unknowingly wake up due to these apneas hundreds of times throughout the night. There are two main types of sleep apnea, and a person may sometimes have a combination of both. The type of sleep apnea which is the most common is obstructive sleep apnea. Obstructive sleep apnea occurs when the muscles become relaxed, which causes the airways to be blocked. According to the American Thoracic Society, OSA is more common in men, women after menopause, and people who are over the age of 65. Obstructive sleep apnea can also occur in children. The American Thoracic Society also states that people with high risk of developing obstructive sleep apnea are people with enlarged tonsils or a family history of obsessive sleep apnea and excessive weight. The less common type of sleep apnea is called central sleep apnea. According to MayoClinic.org, central sleep apnea occurs when the brain fails to send a signal to your breathing muscles, which means that the body does not try to breathe. Like obstructive sleep apnea, central sleep apnea can happen hundreds of times a night. It can cause a person to unknowingly wake up many times gasping for air. According to the American Thoracic Society, risk factors of central sleep apnea include heart disorders, neurological conditions, opioid medications, kidney failure, and living at high altitudes. Now that we have covered what sleep apnea is and what causes, let's talk about symptoms to watch for and health complications that can result from sleep apnea. The symptoms of central sleep apnea and obstructive sleep apnea can sometimes appear the same, which makes it hard to diagnose without testing. A family member or partner may notice symptoms before the person who has sleep apnea. As a person with sleep apnea, the first symptom I noticed was waking up gasping for air and feeling like I was choking. This symptom was misdiagnosed as indigestion in the beginning for me. Other symptoms listed on clevelandclinic.org include waking up repeatedly in the middle of the night, breathing pauses while asleep, which is a symptom that my wife noticed, unusual breathing patterns, snoring, daytime fatigue. Some of these symptoms may appear normal or misdiagnosed without proper testing. It is important to get tested early if you suspect that you or a loved one may have sleep apnea. Untreated sleep apnea can cause health conditions that can be serious or life threatening. Some of these complications, according to clevelandclinic.org, include microsleeps, which causes a person to fall asleep for short periods of time, which can be dangerous while driving or operating heavy machinery. The arrhythmias, which is a change in the pattern of heartbeat, high blood pressure, heart damage, heart failure, and even sudden cardiac death. As I previously stated, getting diagnosed and treated early as possible is very important with sleep apnea. Early treatment can help stop progression and prevent some of the complications which are caused by sleep apnea. In some cases, early treatment can also help sleep apnea be reversed. The first step to treatment is to get a sleep study if you have symptoms of sleep apnea. During the sleep studies, doctors monitor your breathing, heart rate, and how many times you wake during the study. My sleep study lasted from 10 p.m. until 6 a.m. the next morning. Since it was determined that I did have sleep apnea during the first 4 hours of my sleep study, the last 4 hours were used to evaluate how I would react using continuous positive airway pressure machine, which is also called a CPAP, which is used for treatment for sleep apnea. A CPAP machine is the most common method for treatment of sleep apnea, but sometimes people don't like to use it because they may find it uncomfortable to sleep with. Other treatments suggested by the National Heart, Lung, and Blood Institute include oral devices such as a tongue retaining device, removable tongue muscle stimulators, which can be used while you are awake, and in severe cases, surgeries are possible. Weight loss can sometimes also help with sleep apnea. Sleep apnea can be very dangerous, especially if underdiagnosed, but with treatment, especially when diagnosed earlier, the dangers are far less. Today, I have discussed the symptoms, complications, and treatments of sleep apnea. After today, I hope that if someone recognizes signs that they or a loved one may have sleep apnea, that they will seek treatment. Everyone enjoys a good night's sleep. While snoring can be very annoying, hopefully now it could be also seen as a sign that there may be a deeper reason. But hopefully it's just annoying.